I'm Dave Mastovich, founder and CEO of Mass Solutions. We're working with Cucamonga Valley Medical Group, which has dedicated itself to providing communications to patients, families, and the community with the goal of bringing clarity to the COVID-19 crisis. We have Dr. Rahmi Mowjood, Chief Executive Officer of Cucamonga Valley Medical Group, and Dr. Kyle Smart, the Chief Medical Officer at CVMG. Let's start with Dr. Mowjood. Talk about what it would take from a purely medical standpoint for the U.S. to reopen.
Sure. Thank you, Dave, for having us again. There are four main things that we need to look at to be able to get to that end result. Number one, we need to be able to see that hospitals are able to treat everyone that's coming in with this affliction. We are starting to see that. Projections here in California of overwhelming the hospitals thankfully have not happened. We are seeing a lot of sick patients, obviously, but we are starting to see that this is something that we can actually manage. That's the first one. The second one is that we must be able to have the ability to test everyone. That is something that we're still working on. There are glimmers where we are noticing that labs are able to provide testing and that we are able to provide testing in the hospital setting as well, but it's not widespread, and it's got to be widespread so that we're covering the entire country there. Third one, we need to be able to monitor people. So if you have someone that came into contact with someone that had it, how do you monitor that? In some countries around the world, they're doing that through GPS apps on people's phones. That might be a challenge here in this country, and that might not be something we could potentially rely upon. So we have to continue to find ways where we can do the self-monitoring locally. And then finally, you have to be able to see cases start to drop steadily over a 14-day period. Now, if all the other things are happening, then you will start to see that. Our efforts currently are showing that this is actually starting to happen as well. When we have seen states get to a peak, they start to see that curve start to flatten. That definition means the cases are actually dropping. So those are the four criteria that we look for.
I think I would want people to understand what that looks like on a more detailed level, and how a more surgical approach is different than the current approach of social distancing. So the more surgical approach is 3 steps, like Dr. Mowjood talked about. It's testing, it's monitoring, and it's really good quarantine. So the testing, it can happen in 2 ways. A nasal test, where you're checking antigen and for active infection. And second is a blood test, where we would look for antibodies to see if someone's developed an immune response to the virus. The important things to think about in both of those are the speed which we get the results back and the accuracy of the testing, what medical professionals call sensitivity and specificity. Second is monitoring. Monitoring is referred to as tracing, which actually means contact tracing. And contact tracing is identification, keeping a list, and then following up with those potentially exposed people. And that is where a big coordinated effort would need to take place. Third is quarantining. So when you find somebody that is sick through the increased testing, and then you've gone and done contact tracing and got a list of people that infected person may have exposed, you need to follow with them, and all of that group needs to be quarantined. And it takes a lot of people, a lot of data tracking, and a lot of follow-up to help people get medications, safely get their groceries, safely get their to and from doctor's appointments, etc. But that's worth it, because then that group of people get quarantined and the rest of society can get back to a more normal life. So there's a trade-off. Right now, we're doing a very large brushstroke approach where everybody's getting caught in the dragnet and everybody's having to socially distance. And if we can get a local, state, and federal coordinated effort to do the more surgical approach or detailed approach or fine brushstroke, then that's another way to get to herd immunity and an R0 of less than 1.
Dr. Mowjood, talk about what would have to happen in your eyes from the local, regional, and federal level as far as this being able to test and monitor so that we can do what Dr. Smart was saying and have a portion of the population go back to somewhat normal and the others being self-quarantined and so forth?
Well, I think it's important that this question is answered in the context of what we're doing right now. So currently we are on lockdown, like Dr. Smart said. Everyone is in this 3-month frame where we're social distancing. At some point in time, we're going to get to a new normal, and we're going to start to come out of our homes, and we're going to start to venture out and start to live life as best as we can. The studies show that there will be a potential other second outbreak. How do we manage that outbreak? Hopefully between now and that second outbreak, we're increasing the ability to test. We continue to be able to manage patients in the hospital. And by being able to do that, we're going to be able to reduce what that curve looks like second time around. And then, the timeline for a vaccine is always still prevalent in our minds. That also will help. And continuing to learn the lessons from now and apply them into the future will be what will help us get through any future outbreaks that we may be dealing with.
Dr. Smart, you mentioned 2 different types of testing. Talk about that and where can we improve so that we achieve one of the goals that Dr. Mowjood said at the beginning of his 4 goals with the testing being more readily available. Talk about the 2 types and where you see it going and when we can see some improvement.
The 2 types of testing are an antigen test, which is what we've all become familiar with is the nasal swab. And that's testing for active infection. The second test is a blood test that measures antibodies or somebody's potential immune response to the virus. Both of those need to start happening significantly more so that we can test everybody like other countries are doing, and they're having success. And everybody keeps pointing to South Korea. They've implemented testing often and early, and it's helped them direct who to quarantine so that other people can maintain a more normal life. The speed of getting those results is critically important, and the accuracy of the tests is also important.
Dr. Mowjood, if we could close with you on talking about what your optimistic, hopeful view is of what might happen next, and Dr. Smart, you can jump in with your close as well.
Thanks, Dave. Well, I know that different parts of the country here in the United States are going through different challenges right now. Some of us are seeing a lot of struggles in places like New York, and here in California, we're seeing that, hey, we're doing a decent job and we're not seeing as much of a struggle as we thought. What this is saying is that there is light here. This tunnel is starting to get smaller and smaller, and we're seeing the end. The measures that we have put in place are effective. We need to hold fast to that. We need to avoid the temptation to start to get a little lax and to back off of that. Like we've talked about in prior videos, this is not a sprint. This is a long marathon, and we've just gone through the first few miles. We've got a number of miles to go, and we've got to pace ourselves. So we need to continue to be vigilant, continue to hunker down and stick to the protocols of social distancing to allow that curve to be flattened and to prevent the needless loss of more people because we're taking care of them.
I agree. The goal is to get to herd immunity of 60% with as little human cost as possible. Both strategies we've discussed get us there. One just gets us there where we're all participating in the social distancing and the quarantining, and the other one is more strategic and intentional, but allows only those who are sick to be quarantined so the rest of us can get back to the new normal, as people are calling it. The second one, though, requires a coordinated effort that we have not yet seen in this country, and that's a coordinated effort among local, state, and federal government and agency.
Thank you both, as always, a very insightful and truly living up to your goal of this, calling it bringing clarity to the COVID-19 crisis. Thank you, Dr. Rahmi Mowjood and Dr. Cal Smart of Cucamonga Valley Medical Group. More videos to come.